Hello everyone, my name is Kaylin Creel and today I will be presenting my project on maternal mortality and pregnancy-related health disparities in Mecklenburg County, North Carolina, with particular attention to the Huntersville community. This project examines how race, socioeconomic status, access to prenatal care, and other social determinants of health influence maternal outcomes. The goal is to better understand these disparities and identify evidence-based public health strategies that can improve maternal health and reduce preventable deaths. Despite advances in medicine, maternal mortality continues to increase across the United States. Within North Carolina, racial disparities remain substantial. Black women experience significantly higher rates of pregnancy-related complications and maternal death than white women. These differences are associated with unequal access to healthcare, socioeconomic conditions, chronic disease burden, and structural inequity. Mecklenburg County is one of the counties where these disparities continue to affect maternal health outcomes. The purpose of this study was to examine maternal mortality and pregnancy-related disparities among women living in Mecklenburg County. The objectives included comparing maternal mortality between Black and white women, evaluating access to prenatal care, identifying important social determinants of health, and using current evidence to recommend interventions that may reduce health disparities and improve maternal outcomes. The 5 major public health organizations were reviewed for this project. Although each source used different data sets and statistical methods, they consistently reached a similar conclusion. Black women continue to experience disproportionately poor maternal outcomes and limited access to health care, poverty, and inadequate prenatal care, significantly increasing their maternal health risks. The studies shared several similarities. Most relied on large public health surveillance systems and used descriptive statistics to summarize maternal outcomes. Several studies also used regression models to examine predictors of maternal mortality. These primary differences involved geographic focus, sample populations, and statistical techniques, where national studies provided broader generalizability, while county-level reports offered more locally relevant information. This project used a quantitative observational design and analyzed publicly available maternal health data from several national and state organizations like the CDC, NCDHHS, March of Dimes, KFF, and the NIH. Variables included race, income, insurance status, prenatal care access, maternal mortality, and severe maternal morbidity. These variables were selected because previous research consistently identifies them as important predictors of maternal outcomes. Several statistical techniques were used, such as descriptive statistics, comparative analysis, trend analysis, correlation, and linear regression. Descriptive statistics summarized the data, while comparative analyses evaluated differences between racial groups. Trend analyses examined changes over time, and correlation and linear regression were used to determine how socioeconomic variables and healthcare access were associated with maternal mortality and pregnancy complications. The analysis demonstrated significant disparities in maternal health outcomes. Black women consistently experienced higher maternal mortality and severe maternal morbidity than white women. Women with lower incomes and inadequate insurance coverage also experienced worse outcomes. Overall, healthcare access and socioeconomic status were among the strongest predictors of maternal health. Based on the findings, several recommendations emerged: expanding access to prenatal care, improving Medicaid coverage, reducing transportation barriers, increasing culturally competent care, addressing implicit bias within workplaces, and strengthening community-based maternal health programs would substantially reduce disparities within Mecklenburg County. In conclusion, maternal mortality remains an important public health issue within North Carolina. Significant racial and socioeconomic disparities continue to exist, but many pregnancy-related deaths are preventable. By improving healthcare access, addressing social determinants of health, and implementing evidence-based interventions, communities could reduce maternal mortality and improve health equity. Thank you for your time, and I welcome any questions. I can be found on my email, kaylinCreel@Regis College, or at my phone number, 704-343-1760. Thank you for your time.